Taking care of your bottom after a vaginal delivery. So you may end up needing stitches, and if you do, those stitches dissolve on their own. So you don't need to come back in the office. We're not going to have to remove them or anything like that. They're going to dissolve on their own. The hospital is going to give you a peri squirt bottle, and you're just going to rinse off every single time you go to the bathroom. You can take that home with you. Don't worry, we're not going to ask to have it back before you leave. So you can take that home with you and continue rinsing off every single time you go to the bathroom. That's just going to help keep it a little cleaner down there and decrease your risk of getting an infection. Signs of having an infection may be a new burning sensation down there, a fever, those things like that. So if you experience those things, go ahead and get them checked out. A burning sensation may happen when you first start peeing after having your delivery, and it shouldn't be something that continues, and it shouldn't be something that worsens over time. It should be something that gets better, is initially maybe bad, and then even like a couple seconds into midstream, it feels a lot better. So that peri squirt bottle you use to rinse off, you can actually use that to spray before you pee, and that can kind of help with that burning sensation. Even if you don't have stitches, you may feel that. Sometimes women have what we call skid marks. It sounds really bad, but it's like rug burn down there, and you won't need stitches because it's not a tear, but it's a lot of like little skid marks that whenever you pee, you may have a lot of that burning sensation down there. Sometimes you have a tear, and it may be like a 1st-degree tear, or maybe you like tore one way but a little bit more another way, but it's not bad enough to need stitches. The stitches can kind of be a little bit more irritating, and so they may not repair those. They may let them heal on their own, and you may have a little bit more burning sensation as well. That's something to keep in mind, that you can sometimes tear different ways. I think we typically only think about like downwards, but it can kind of happen whatever way baby came out and how they were positioning. Tearing is a natural thing that does happen when babies come out. Sometimes it's that tear that happens on its own, but a doctor can also do an episiotomy or a midwife, but it's something that is not nearly as common today because we've learned that it's not really best practice to do. So this is when they do an actual cut from your vagina down your peritoneum, and with this they used to do it kind of more often, but they found that they would cut and then it would still continue to tear, and it would actually make the tear a whole lot worse, and it would take longer to heal. It's actually really crazy to look at old things they used to do back in the day and how really messed up it was. And so they've determined that's really not best practice to do. I will say some doctors get really impatient and do it. This is something they do need your consent to do. And so I would just kind of make sure you're having that conversation and getting a feel for your provider. You are interviewing your provider for a service, and I think that's an important mindset shift to have, is that you're hiring them for a service. You're coming into their office just the same way you are coming into anybody's office, whether that's a hair care appointment or whatever. You're hiring them for a service. So you can ask them, what are your episiotomy rates? How do you feel about episiotomies? And just get that feel for them. You can also ask what their tear rate is. I've worked with providers that every single delivery they had was a 2nd-degree tear. And I think, what were you not doing during the delivery? Or were your hands in there, like too much happening? What was going on? Because that person constantly had those tears. You can also ask them, what are your C-section rates? If you have a good provider, they should feel really great about their rates, and they have no problem talking to you about it because it's something they're proud of. And if you have a provider that you're asking those questions and they're just like, oh, you don't need to worry about that, it's your right as the patient to be educated on that. So you can definitely ask those questions, and you can find a new provider at any time during your during pregnancy. It is totally up to you. So that's my little tangent on your finding your provider and your right as the patient. But with episiotomies, sometimes it isn't a emergency situation where baby's heart rate is down and not coming back up, or it's taking a really long time and it's really low. And going back for an emergency C-section would take longer than doing an episiotomy and helping getting your baby out. And so in those situations, that's what they're there for, but it shouldn't be the norm that every provider is doing for all of their patients. So even if you didn't tear, you may still feel really swollen down there, and that's normal. They usually suggest having an ice pack on for the first 24 to 48 hours after delivery. And I say that, but if you're someone who you don't like the way the ice pack feels whatsoever, you are not a fan of it, you don't have to do it. You can do whatever is right for you and whatever you feel most comfortable with. And that may be like doing an ice pack one time, and then the next time you decide, no, I want to do a regular pad. Or maybe you want to do the Tux pads, the witch hazel pads. You can do that. You can also do an ice pad with witch hazel pad. If they have some kind of creams or numbing sprays, you can do that. Every hospital has a little bit different supplies, but some of the main ones you will see is an ice pad. It can be one of the disposable kind that you pop it, you just fold it and it pops, or you can twist it and it pops, and you shake it and it's used for down there. Sometimes the ice pads, though, they don't absorb as well as a regular pad, and so you may look like you're bleeding more than you actually are. Putting either a pad on both sides of the ice pack can be helpful, or you can do a chuck pad. You may hear this called like a puppy pad, one of those big blue pads, and you can like try fold it up inside of like put that on and then put the ice pad on, and it'll absorb anything that may fall out of the side. So that's an option that you have as well. You can also use, like I talked about, the witch hazel pads. So those are just little circle tuck pads that almost looks like you're making a sandwich, is what I always feel like whenever I'm setting up someone's supplies. You can put the witch hazel pads on. Those are really great. You can take home with you, and you can put them in like the refrigerator, and they feel really nice. You can also do like a homemade Tux pad where you take a Ziploc bag and you put some of those like round cotton, they're not cotton balls, they're like cotton rounds or something like that. You can put those and like spray some witch hazel in it, and then just put it in the refrigerator and use that when you go home as well, if you don't have any more Tux pads from the hospital. You can make your own homemade ice pad if you want. There's two different ways that you can go about doing that. You can do where you take a pad. This is really great when you're getting ready to have your baby before going to the hospital gym. You can take a regular pad, put some aloe vera on it, and just kind of, I feel like I'm making a sandwich again. You just go ahead and you spread that on, and then you take some witch hazel and you just drizzle it on, and then you fold it back up and you put it in the freezer or the refrigerator, and it is a little ice pack that's soothing for your bottom, already pre-made, and you can have those when you come home. You can also take a diaper, make a little slit in it, and like shove ice down it. Crushed ice is really good, like the kind from Sonic or something like that. Hospital ice is really great, and sometimes I'll make these for moms who are really swollen and the regular disposable ice pads are just not working. And so or maybe the hospital ran out of it, because we do run out of supplies sometimes. I'll take the diaper, make a little slit, and open it up and just have some ice going down in it, and then stick the part that usually goes on the baby on their bottom. And this is great because it absorbs the blood, for one, so it doesn't make as much of a mess, and it also absorbs the ice as it melts. And you just kind of like pull up the edge, you can tape it or whatever as well, but just fold it up, and now you have an ice pad that you can just toss out whenever you're done. Great homemade ice pads to make. They also have different kinds of sprays. They're just like a numbing spray. I've worked at places where they're actually flavored because it's like a mouth spray that you can use down there. So they have different sprays. They also have creams that are maybe numbing. They may be foaming out. They may have what they call honey that will be for your bottom, that helps with any kind of really bad tears and different things like that. If you're worried about the paste getting on you and it's just like a numbing paste or cream, you can go ahead and put that on the ice pad or regular pad, and then put those witch hazels on top, and it'll absorb through the witch hazel and get on you without having it sticking directly on you. So that's an option. I would ask your postpartum nurse, your labor and delivery nurse who's cleaning you up, hey, what are supplies do you guys have here? Because they may order it as what they call PRN, which means that you have to ask for it. And if they're going in and they're saying, how are you feeling? And you're like, oh, I'm sore, but I'm fine. They may say, okay, she doesn't need anything. So always talk with them. Hey, what kind of supplies do you guys have? I'm really feeling sore down here and I would like something for it. So even if you don't have a tear, you can still have that swelling going on, and that may be really soothing for down there. Hospitals typically have those mesh underwear. I've had dads say that they need some more fishnet underwear for their wife, and that's what they're talking about, is the mesh underwear. You can use those. You can also use Depends, like adult diapers. A lot of moms really like, because they feel like it just kind of helps support everything down there and holds everything in, and there's not as much shifting, and plus you can just like toss it and not have to worry about it. You don't have to worry about pads or anything like that when you're not feeling so sore down there, but you just want to kind of catch everything. So disposable underwear, Depends, things like that you can use. You can also use regular underwear if you want. It's up to you. Whatever you want to do for your bottom is totally okay. I suggest any of those puppy pads or chuck pads, you may hear them called, though. If you have any left in your room, take those home with you. It's really great to put in the seat that you may be sitting at in your house, or maybe your bed. You don't want to get your bed all dirty as a just in case catch-all. You can have that there for you as well. They also have something called sitz baths, and this is like a tub for your bottom. You can either do just plain warm water. You can also do some kind of herbs. Some providers may suggest different kind of herbs and things like that. They may suggest you doing like an Epsom salt or something. Some providers and midwives are really big on these. I think that it is a undervalued thing. A lot of hospitals have them, and you can have just like a disposable one that you can take home with you. You can toss it out when you're done. You can order them from anywhere, and it just kind of rinses off your bottom. A lot of them have water that sprays up, but you can also just sit in it, and it's very soothing for down there. Just the same way if you were sore anywhere, being in a warm tub just feels nice. Some providers may say don't worry about necessarily a sitz bath, but you can do some warm water with some Epsom salt or herbs in a tub, and just be in the tub for like 15 minutes and then get out. Some providers are totally against that and say absolutely not. There's no way that you should be in the tub for any period of time. And so just talk with your provider and do what feels best for you. Speaking of sitz baths and witch hazel and tux pads and different things like that, and creams, some moms have postpartum hemorrhoids, or you may get hemorrhoids during the end of your pregnancy. And this is because all the pressure that's down there. You can either have internal hemorrhoids, like they're still inside of your rectum, they haven't came out, or they may have came out. Some of them bleed as well, so you may have that happening. And they should go away on their own. Some of them don't. Sometimes people will have them removed. I hear that's not pleasant either, but that's an option. It should go away. And you can either use, like I talked about, the tux pads. There's different types of creams that you can use, like hemorrhoid cream. And the sitz bath are really nice for down there as well. Moms who sometimes pushed for a long time, and just all that pressure pushing down there can cause those hemorrhoids. But just like anything for your bottom, do whatever feels best for you and whatever feels soothing. And if you need a little bit more support or you need more supplies, let us know. Some hospitals I've worked at are like, we only give out an X amount of things and that's it. And other places I've worked at, they like hand them out like nobody's business. They send you home with all this stuff. So talk to your nurse and get all of those supplies that you may need. Whenever the provider comes in and rounds on you to check on you, if you're feeling really sore down there and you feel like something's wrong, ask them to look at it, or ask if they can order something else if it's not ordered. I have plenty of moms who are like, something feels wrong down here, and I mean, it may just feel wrong because a lot happened, but I've had people over the years be like, can you just check? And I know some nurses that check all their patients every single time, and so that's an option that you have. Just communicate that with your provider. Next, we're going to talk about a C-section delivery, and I highly encourage you to listen to this section even if it's your first baby and you have no risk factors that indicate that you may need a C-section, because sometimes C-sections do happen. They aren't planned, and it's something that I want to make sure that we're covering together. And so please go ahead and listen to this next part, go through it, and just at least absorb some of the information, because it may actually be something that you need to know about. That may be the way that you birth your baby.